Welcome everybody to another installment of Yoga Therapy and Yoga Life graduates. Today, oh no, Maddie Tuohy.
Tuohy.
Maddie Tuohy. So just so you all know, I met Maddie Siegel. It's really easy to pronounce. And she's been married and now has a 2-year-old daughter. We're so excited to hear this news and so forth. And Maddie has been a personal trainer prior to doing her whole yoga journey. And so it really blends well with her yoga therapy. And as I do with these interviews, I like the person to take over. So I'm going to have Maddie. She's now in Northern Virginia, where she's from. And maybe have her start, you get to know her. So, Maddie, where did your yoga journey start? People have these unusual beginnings. One person said I was 12 and my mom watched a video with me and how about yours?
Yeah. I like to say my real yoga journey, so yoga as we know it, started in 2014, but I was always very active. I used fitness as therapy before I found yoga. So I had done some yoga videos. I know the lacrosse team, we wheeled in the VHS to do yoga and that kind of stuff. But to me at that point, it was more of something, cross training. So in 2014, I joined a yoga studio on a Groupon. I was working my first job out of college. And super out of balance, just in a lot of different ways. Big life change, grew up with anxiety disorder, depression. So that was really flaring. And little did I know this Groupon would change my life. Just so had it that it was a great studio in DC. It was Washington, DC. And it was just one of those studios that was really rooted in classical yoga and worked the yoga everywhere. I mean, they did all kinds of stuff after classes. People hung out in the lobby and talked. And it was I haven't found a studio like that other than training with you, in my area. So it was perfect. And I went on that Groupon just every week. And at the time I was experiencing intense chronic fatigue. I didn't know what it was from, but that fatigue ended up lifting a couple months into starting yoga. So from there, I was very inspired to keep following yoga, figure out what else there was to it and how I could use it for myself.
How often did you attend classes in the beginning?
Well, because the Groupon it was a month, I think I paid for it. It was unlimited. I was going every other day, sometimes every day, because all I had to do was go to work and come home on the metro. So I would just go. And people always ask what it was about that yoga class. And I think it was just the messaging I was getting, because the messaging I was getting in the real world was so opposite to everything I was getting in that yoga studio. And so I remember just Shavasana, getting out of Shavasana, and I just felt so different. And it prompted me to
Shavasana. Shavasana is relaxation. Sometimes I have to interview our graduates when they say big words like that.
Oh, okay.
That'd be the relaxation exercise after doing yoga poses. Yes? Yeah. Cool. So go ahead. Sorry to interrupt you though.
I was just going to say, I think it was just so lucky that I found that particular studio, because some studios, they might have just done more fitness yoga and had a short Shavasana. This studio in particular, the teachers were really skilled and they kept you really, they used concentration a lot, focusing on the bottom of your foot and those kinds of cues for someone who's highly anxious coming out of a job they hate at the end of the day. I mean, it just completely transformed my life. So it was a pivotal point in my healing journey, because I had been sick since I was 8 with, mental health, anxiety, depression, OCD.
That's awesome. And then you moved up to near us, maybe a year or two later.
I would say I was an extreme case. When I did that, you told me, you were most people keep their jobs. I quit my job to come. Yeah, I quit. I was working for the federal government in contracts, and everyone thought I was super crazy. I mean, my grandpa still is you left FEMA. But I just added this inner knowing. And my boyfriend at the time, who was very serious, one of us had to move. And so I thought it was a divine message, because I walked into a studio in his neighborhood when I was visiting, and the girl who owned the studio had been trained by you. And we got to talking afterwards, and I told her how I would really like to do yoga therapy as a job, but I was stressed out about going back at the time I was looking at George Washington University in DC, very expensive, going back to become a licensed counselor and then also get a YTT, super overwhelmed by that. And she told me, oh, there's a yoga therapy school in King of Prussia. Actually trained there. And I looked it up that night. I remember, I think I even called you because I sent like an inquiry and you called me. And then I called my dad. And I mean, a couple of weeks, I quit.
Wow. Yeah. Christina.
Yeah. Sculpere was the name of the studio.
Yes. Yeah, she's our good friend. So, yeah, so we spoke and then you thought about it. And then I guess you kind of did that whole teacher's training with us and right into yoga therapy after that.
Yeah. Mm-hmm.
So at that juncture, our program's now 2 years, a little more intensive in the yoga therapy, but yours was 3. So it was like a 4-year process.
Mm-hmm.
I guess.
Yep. So, yeah. So why don't you tell us what it was like, say, finishing teacher's training after you already had really good experience with yoga, which, like you said, you were very lucky to find that beautiful studio. But then how did teacher's training, where did that take you, that leg? Well, as you say a lot, teacher's training uncovers a whole bunch of other healing. So that whole year in teacher's training was, just constant learning for myself. Like those monthly papers we did, and just kind of like dissecting and using the yoga philosophy on my own life. So at the end, I was really excited to go into yoga therapy, and I felt very ready because your program kind of eases you into it. If you do the teacher's training with YogaLife, you have such an advantage going into the yoga therapy program. So I felt like I had I would say a leg up, I guess. And I already knew how you guys taught. So when I got to yoga therapy, I was comfortable.
So how do we teach, or how did you learn?
Well,
like when you say integrate this yoga philosophy, that would not be a normal thing that the majority of people going to a regular yoga class at the Y or some fitness place would experience, because they would just have the class and then they would,
Right. So I think that my experience with YogaLife, especially in the teacher's training, was you're given an overview of a topic, right? Whether you're learning a set of types of poses or philosophies. And then after you're given the topic, you go back and you study and you read up on it through the educational resources, and then you practice it for yourself. And then the papers kind of force you to practice it for yourself. You have to figure out how, through a different lens, you're using that, say like a niyama and a back bend. And so I just thought that was a really interesting way to learn. It really helped me apply it to my own life.
So I think this would also help your clients know you too. So the word niyama is like a positive lifestyle exercise. And that she used another big yoga world. See, she's really smart. And yeah, she studied really hard. So so you do like one of these positive life observations and you connect it to a yoga pose. Like, how does that would also seem very different than like doing a yoga pose for strength.
Mm-hmm. Yeah.
Because you still can do a yoga pose for strength and think about the observance, but how do you do that in particular?
Yeah. So, say we did a class on, I can remember the mountain poses very vividly, like did that with Kristen. And at the same time, we're practicing the niyamas and writing a paper about it. Throughout the week, you have the opportunity to focus on, let's pick contentment, for example. That's one of the niyamas. So from my lens, how am I practicing contentment in my own life? And really walking through that. So it might be something as simple as like when I'm walking my dog, and I'm able to keep my mind quiet, the contentment I feel just being in nature in the moment, contentment, right? Something I wouldn't have normally thought about. And then it adds value to my life and reduces my stress. So I think that's an example.
So would you then, like, I kind of know the answer, but I want you to say it. Like, so then the contentment in the mountain pose,
mm-hmm.
like, do you then think about contentment while doing a yoga pose?
Exactly. Yes. Because you're learning
how does that work? See, we don't know how that works. How does that work? I know, like she's told me stories, for example, how she's got clients to then do like a yoga pose, but think about something like contentment. So that's why I wanted her to tell you.
Yeah. So it's like having that, I mean, it's a niyama, but also like an attitude while you do the yoga pose. So you're concentrating your mind on the contentment piece, feeling good in your body, feeling strong, pressing through the floor, feeling the earth, feeling connected, and that can bring you contentment. And so you're integrating the philosophy with the anatomy.
Interesting.
Mm-hmm.
Very cool.
And then I really enjoyed about the
yeah?
program. I loved that it went so much deeper than just poses.
Yeah. How do you, so obviously, I guess that's the way you teach when you teach yoga classes.
Mm-hmm.
How are some examples how do you see that affect people?
It helps people anchor themselves. I think so much more than anything else, what I notice at this particular time in our history is that people don't know how to be still, even if they do practice yoga occasionally. So I think having those extra cues, that extra layer of teaching is really powerful, and it helps people direct their attention, which just reminds me of one of the 8 steps of yoga, which is concentration. The mind is just like so busy, everyone's overstressed, overworked, not taking enough time to rest. So I think, having that extra layer, it's just another tool in the toolbox.
And then if somebody does get their mind to be still, okay. And again, this is questions I get all the time. So I'm just dying to hear your answer, actually. And you all, this is not rehearsed. Okay. We knew, like, she knew we were going to talk about her journey, but we didn't rehearse all these questions because I want this to be real and hear what comes straight out of Maddie in an interview. So, where was I going now that I told that? Okay. So when somebody has the actual stillness, I have had people tell me, well, that sounds boring. Like they've told me, why would it stillness, but like, I'm going to get lazy, or I'm going to not care about my life, or so why is stillness better than like having a active mind?
I think about it like this. I'm always calling my classes healing, and some people are saying, I don't need healing. I'm just coming to yoga. And I'm like, well, everybody is in a sympathetic nervous system all day. It's just in this town that I'm in, you're running from meeting to meeting, you're taking the kid to daycare and dropping them off, you're going to work, you got 16 emails unopened or 1600, whatever. And then you come to yoga and you're doing strengthening poses the whole time. You're still in sympathetic nervous system. So in my classes, even if it's important to strengthen the body, but I always take the time at the end or, throughout the class to bring you into that parasympathetic. So in simple speak, that's fight or flight, sympathetic, go, 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 go. And then parasympathetic is that rest and digest. And whether you like it or not, you're healing there. Whether you're healing a sore muscle or your digestive system is resting, that's healing. And quite frankly, we all need it. So that's what I tell those people who feel like they can't relax. And funny, I had a class yesterday. I teach at the gym, which I'm actually not a big lover of that environment for yoga, but after having a kid, they have daycare there. And so when I come to teach, I can bring Riley and I can work out, and I actually love it now because they're so the opposite of yoga people, or people that would go to yoga voluntarily, right? Like they're lifting weights and they're checking their phone all the time, and people like to bring their phone into class, and you're like, no, we don't do that. But anyway, I taught a namaste through the holidays yesterday as like a pop-up, and I intentionally went to the strength class right before it. And everyone from the strength class, not everyone, but like everyone in my class after was from that strength class, because at the end I announced it and I said, y'all just worked out really hard, you should stay and like slow your heart rate down and get a really good stretch. So it was interesting to teach to that group, knowing, kind of that. I had a woman come up to me. She said, I've never done yoga and I'm not a yoga person. And I was like, well, just try it. You need to stretch anyway. So, and it's interesting to see them when they leave, right? Because they were very relaxed.
So, yeah. So then just to contextualize what you said, because you were on the spot, everybody. I did put her on the spot, but she just answered that and crushed it, by the way. So sympathetic nervous system is like when we're active, like technically right now, you and I are in a sympathetic nervous system because we're talking, we're thinking, and so forth. And then the point that I think you're emphasizing is that we're in that way too much for the average, like, human being for our own needs. Yes?
Yes.
and like checking your phone and then driving and then going and going. Like the whole day is like that. There's never like a relaxation moment in our day.
Mhm.
So
Yeah,
that's why
exactly.
when they come to your class, you make sure that that's an element. So everybody drops down and then they leave much calmer.
Mhm.
So that would be why one of the reasons why having a still mind is so important, because then the parasympathetic, you took me to a whole nother level I wasn't even thinking of going to, like with the uh, scientific side and the health side. Yeah,
Mhm.
that's pretty powerful, because then if you live your life in a more focused way, your parasympathetic can kind of be around even though you're doing stuff.
Right.
You
You
know what I'm
can
saying? And
train
like,
it to be easier to get into it. So the more you go to yoga and practice meditation and relaxation, it's easier for your body to get there. Whereas if you never do it and then you do
right,
it and you feel really fidgety and you can't relax, I always tell people it just takes practice. You have to keep coming, and then it just feels
right.
natural to relax, which it should feel natural.
Interesting. Yeah, it should just be
Mm.
natural, right?
Mm-hmm.
It should be natural. Yeah, and I often get images when I hear things like that of like somebody sitting on a bale of hay on a farm.
Mm-hmm.
I don't know if you ever, I've worked on a farm once for a summer and did a few other things like that. Sometimes the truck's not there and you just don't have the tools, so you can't load the hay, bales of hay onto the truck. So what do you do for like 20 minutes? Do you like jump
Mm-hmm.
up and down and check your phone? Well, they didn't have cell phones back then, but you just sit there and hang out.
Mm-hmm.
That's parasympathetic. That would be called normal living. And then you throw the hails of bales of hay when the truck comes by, and then you go do your next job. But yeah, that's just so important. So I'm going to guess that when you start doing yoga therapy, which is like working one on one with people, this is probably one of your big go to. Is that what you think about when you see clients?
But depending on their intention for coming to see me, because I do see some people who say they're not stressed, but the majority of people are stressed. I think doing a breathing assessment in the beginning is really helpful for me because I just had a lady come to me because for chronic stiffness, yoga therapy. She said she didn't really have stress. She handled stress well, but I wanted to watch her breathe because I was curious about the stiffness. Even if she wasn't stressed out, maybe she wasn't breathing into her body in a correct way, and then those muscles stay tight. They've got to expand, with the breath. So I always do a breathing assessment.
Interesting. What did you learn? What do you
Um,
learn when you watch people breathe? That's fascinating. I've never
well,
had somebody tell me, "Oh yeah, I observe people breathe like in normal in everyday existence." You know what I'm saying? Although I do the same thing a little bit.
yeah, of course. Well, you taught it to us. I remember doing the breathing assessment and training with our partners, and but you can noticing how they're breathing will tell you a little bit about their nervous system because if they can get a nice inhale in and then and spread it, if their diaphragm can contract and relax with their breath, then they're breathing correctly. But if they're breathing up into their chest or they're barely getting any movement into their stomach, you can tell that they're probably holding their breath a little throughout the day. And that can cause excruciating tightness through the abs. It can cause a lot of tightness through the sides of the body. And I work with the prenatal, postnatal population, and when they get a lot of ab gripping, particularly because afterwards, they're trying to work on their core right away, but they just delivered a baby, and so they have a really hard time getting a breath down. And so it gives you so much information about where you can go with yoga.
Interesting. Fascinating. So that's a
Mm.
good tip for all of us, that to keep our lungs moving. Yeah, it connects to your spine, connects to everything. So maybe if I just jump half a step back. So as you went through yoga therapy, how did you determine who you were going to work with, and like how you saw yoga therapy helping people and such?
Well, I always just thought of how it helped me, and I became fascinated with the idea of yoga therapy before I knew it existed when I was working in group therapy, traditional group therapy, and taking yoga classes. And I found that I kept suggesting things to the people in my group because we would meet after without the therapist, just us, the patients.
Mhm.
And I kept being like, you should, suggesting the meditation stuff I was trying or, just different yoga practices. And then I became fascinated with combining them. So I think that's where my passion started was using it as an alternative form of therapy for mental health. And I think that's definitely a niche of mine. So anxiety and depression are my wheelhouse, but outside of that, there's so much with anxiety and depression, right? So like chronic pain, postpartum, like the whole postpartum phase is extremely stressful. And so that obviously came later when I was pregnant and had a baby, but I think initially anxiety and depression.
Mm-hmm. Mm-hmm. So what would you say for somebody listening that either has a friend like that, if you were going to help them, I don't know, how does it work maybe, or what do you have things you recommend, or how do you approach it?
Like seeing a yoga therapist or doing yoga therapy, or which part?
No, like when a client comes to you, how do you approach them, or how do you handle it? Like obviously a breathing assessment you told us, so I'm going to guess you you do that with almost everybody.
Yeah.
So then, like, what happens next? Like with
Well,
a
I always
client?
like them. I always like to each session. I always like to know what the intention is that day, or just in general. So through my intake process, I find out kind of what are their goals, where do they want to be, and what are they looking for, and what is the pinpoint of their suffering. You know, like some people, if they have chronic back pain, they're uncomfortable all day, so that's the pinpoint of their suffering. Or you know, if they have a running mind and they can't get their thoughts to slow down, then and when I can find that pinpoint of the suffering, then I can bring in the tools that I think would be helpful. Then I let the client lead the session, but just introducing different education around how to find relief.
Yeah. So when you say pinpoint, does that mean I could come in with back pain and you would end up telling me actually the pinpoint is in my mind or somewhere else?
Could be.
It could be.
Yeah.
Or is that what you see? I'm just curious.
I think I see a little bit of both. I think it's mind body. So when we have back pain, a lot of it's going to be caused from up here. You know, but some people might just be loading incorrectly when they work out. Other people, you know, might hate their job or not like a situation in their life and be resistant towards it. And then it creates back pain. So it really depends on the person. So I have to ask a lot of questions to get there. I'm not able to generalize it.
Right. Right. So obviously, you know, we ask all these questions from so many different angles. That makes one of the things yoga therapy is unique, because we look at each area of the person, not just one section. Like, you know, the psychologist looks at the mind and the emotions maybe, and then the physical therapist looks at the body. Your doctor looks at all your vital statistics, right? And you're kind of, although you're not doing any medical diagnosing, you're, in terms of like stress and so forth, you're looking at all these things.
Yes.
It's very fascinating. Yeah.
That's why I love
it. Oh yeah.
Yeah.
I hear similar stories from, you know, with people interested in different topics. So that's really cool. So obviously it's very, go ahead.
I was going to say, I've always been someone who a huge empath, and then always loved to help. Like as a kid, they used to call my mom at the gym and say, she's got to tell me to stop taking care of the babies in there. Like I was always taking care of people, but I knew I didn't want to do anything in the direct medical field, like a nurse or a doctor. And I think that's because of my experience with it and the experience with the mind and body being separated. So the integration is what excites me so much.
Interesting. Yeah.
Mm-hmm.
That's so cool. Keep going.
Oh, yeah. So
go ahead. Yeah.
Oh, when I was
tell us about the integration a little bit. Yeah.
So one of the topics for this interview, I know, is like, what are my goals? And my goal is to find more and more integration. So since having a daughter, I started teaching at a Montessori school because I could bring her. In the beginning, I was bringing her when she was little. And I really loved their philosophy, so it worked out. But I was integrating mindfulness into their day of learning, which I love. You know, these little people get this hour with me to kind of downregulate before they go back to learning. And we know from studies that that's so good for your brain. So we're fostering, you know, more learning that way. And I just came from another one. I also teach at a micro preschool, which it's kind of a part of unschooling. So it doesn't look like a school. It's called Ohana. And so it looks kind of like a surfer. You know, they've got blue concrete floors, and It's all open. There's no enclosed rooms. All the different age kids are in the same huge space. And anyway, it's just so cool to sit there. Like today, we actually learned the word shavasana because there's a little song we do. But it's so cool to sit there and just and watch that integration, right? Because they're going from learning about the continents to Sanskrit. And I just think it's so cool. But my dream is to get this into the hospital system where I suffered so much, like where there was no, it was black and white. And then I see that just on a consistent basis, with every major illness. People, we need this integration to be successful. People, the hospitals serve such a great purpose. They save our lives. They're amazing for trauma. But I was just there recently with my husband when he had COVID, and there's no whole person approach, which is so lacking. A person leaves with so little tools. You tell, the diabetic goes home and they're still not eating right. The heart patient goes home and they don't know how to exercise or breathe correctly, but they got their medicine. So I think when we can finally integrate it, it'll be magical.
Interesting. Yeah. Yeah, I agree. So yeah, those are nice goals. We're all, so many of us are working toward those goals, so eventually, I think it will come together again because it works so well. And so maybe you can add to this. So if I go in and receive some integrative care, I start to realize that I'm a part of my own healing process and there's things I can do. Is that right?
Yes.
How would you add to that? How would you finish that paragraph?
There's things you can do. You're in control of your own healing.
Oh, really?
Yes. In yoga therapy, we learn that the mind is at the seat of healing. So your mindset is so important when you're going through that process. If you're being treated for something and you think, it's worthless and it's not going to work, or, you're never going to get better, then you're never going to get better. And, your mind is just so powerful. And so shifting your mindset, just for an example, when I had Lyme's disease, I think meditation was the best treatment I received. Yeah, I took the antibiotics and I did all that, but I would lay there in the sun and I had this mantra, my body is healing incredibly well. And, before doing all that, I went down the rabbit hole of negative self-talk because I was so frustrated with, the expenses and all the supplements and how tired I was and nothing was working. And so when I started to work on, this part, the mind, I think the healing accelerated.
Interesting. Yeah. You hear a lot of miraculous stories like this where people shifted their mind and then all of a sudden things improved. But we know, without even being miraculous, needing a miraculous story, we know that stress affects every system. The way you describe the parasympathetic and the sympathetic nervous system, if we're constantly in a state of fight and what do you call it?
Fight
or flight. Thank you.
Freeze. Fight, flight, or freeze.
That's true. Or freeze. Then your digestive system, like you said, starts to kind of knot up and doesn't work as well. And then you can just imagine your breathing decreases. So your body has less oxygen. Then you start to have a little bit of a lower energy. Yeah.
And a great example for this would be somebody having like chronic stomach issues and they're going to the gastroenterologist, or get put on pills for IBS, for example. But at home, they're rushing and they can't sit down and chew their food because they're always chasing after a kid or answering a phone, or, they're not allowing themselves to have that lunch break. So they're creating inflammation in the stomach. So that's an example. Yeah, you can go to the doctor, but until you start doing the lifestyle stuff, you're not going to find the healing that you're looking for.
Yeah. Yeah. The lifestyle stuff. That's awesome. I do know there's a big lifestyle medicine group. So have you ever heard of that?
What?
There's a few people that again, it's a smaller number, but that's where we have to start. Lifestyle medicine. There's like medical doctors that try to teach lifestyle medicine. They agree with you.
Oh, that's cool.
Yeah. Maybe I'll tell you about that group. I know, I'm not sure to what degree it is, how intense they are, but
yeah.
It's always awesome to hear these stories And I guess we got your goals, we got your growth, we've got all the people that you help, anxiety, we've got like stress and such, not enjoying life. And then you've got this kind of newer group with a pre and post natal.
Mm-hmm.
Yeah. So those are kind of your go-tos for people. So if
Yeah, and I
they're
got
if
very
some, go ahead.
I was just going to say I got very interested in the pre and postpartum stage, obviously, because I went through it, but then I had to rework on a lot of things I worked on in the past because the hormone changes, your body's not your own anymore. And I think it's a very underserved field. I mean, you go to the hospital and they send you right home with no, instructions. And so actually a really big goal of mine, and I've had 2 meetings with my hospital, is to be in the labor and delivery ward as a wellness educator to help that process. If people score high on the Edinburgh scale, which is the postpartum depression scale, then they would have the option to meet with me, but also, just education. I became a specialist in the pelvic floor because I had some issues there. And it's funny, studies have been shown pelvic floor and anxiety and depression directly correlate. So pelvic floor issues, anxiety and depression correlate. So just think about all the people who are struggling with that. OBGYNs don't know very much about the pelvic floor. You're just kind of left in the dark. So that's a community I am really excited to serve.
Yeah. I completely understand that. We were educated by a physical therapist who specialized in pelvic floor, and she was one of the very few, just like you said, and she explained exactly you have how important that is and how underserved. So I think the world is lucky to have you.
Oh, thank you.
And all these people that you meet and will meet, I'm pretty sure some of your initiatives are going to come through. And I look forward, maybe, you know what I should say? I look forward to like another one of these interviews when we get to hear about how some of these things turn out.
Oh, yeah, that would be great.
So is there anything else you want to say? We'll start to wrap her up.
I think I'd just say for anyone who's interested in yoga therapy, there's so many benefits to being a yoga therapist and not having to fit into a box of a certain practitioner. You can bring your skills from other, certifications you have and kind of really create a unique practice where you're not, like I said, you can work outside the box and help so many people. So if you're on the fence about it, I say it's just such a wonderful field to be in. So.
Yeah, and you're really good evidence of that. So it's really awesome to see. Thank you very much, Maddie.
Thanks, Bob.
All right.